We knew about the protests. We knew about we saw the articles as they emerged. We saw the TV interviews. We didn't understand fully the depth of this matter.
It's almost a decade later, and again we're having to revisit the Life Esidimeni tragedy, where 144 mental health patients lost their lives. At least that's the official number that we know. From what we've gathered so far, that number may very well be far past that point. But in order for us to rehash and to understand how we ended up here, we'll track the timeline going back as far as 2015.
It was in 2015 that I was first told that no, they're starting to cancel the Life Esidimeni program, which was the company that was looking after sort of mentally ill patients, and that they'd started by, it was actually Stakfontein Hospital, that they weren't discharging them to Esidimeni anymore, they were just frankly just discharging them on the streets. That was the first inclination that I got. So I started to ask questions in 2015 already about whether Life Esidimeni was going to be cancelled. And I remember one of the tricks that the MEC for Health at the time, Gauteng, used to do is before she was forced to reply to a question of mine for written reply, she would release the information with her own spin on it. So it was fairly late in 2015, and she released a statement, a public statement, which was the first confirmation that they were looking to cancel the Life Esidimeni contract.
So what we understand of this plan by Gauteng Mahlangu was that it was part of cost-cutting measures in the department, but because the contract had become unsustainable for the finances of the department, which at the time she said were quite tight. And this now we know to have become the Gauteng Health Marathon project. And part of that was the transfer of about 2,000 mental health patients from the Life Esidimeni private facility to a number of NGOs across the province, as well as some state institutions. Now, as early as 2015, there were already some objections, particularly from the families of these mental health patients, as well as some NGOs, including Section 27, as well as SADC. And the main objection really was that there wasn't a clear plan of exactly how, when, and to where these mental health patients were going to move, and whether or not the facilities that they were being moved to were able to house them, had the capacity, had the training, had the infrastructure as well to in fact take care of them.
From the beginning, the department was not communicating properly. So we attended 2 of the meetings at the Life Esidimeni facilities that were called for family members, where department officials, in one case the former HOD Dr. Bani Selabano, and in the other case, I wasn't at this particular meeting, but the other case, the former MEC, Ms. Gauteng Mahlangu, attended these meetings, and they were trying to reassure families that everything would be okay, but without providing a plan, without providing the kind of detail that families would need to know that things are going to be okay. And so it was quite clear from the beginning that there was some kind of communication breakdown, and we were concerned that the failure to plan or the failure to disclose plans indicated a lack of a plan.
Families were just outraged at the announcement. Because it wasn't like it's a discussion, look, we might have to, maybe we can look at models, or nothing. It was, we are closing, we are telling you that we are closing, and that was it. I mean, in those meetings, they were telling us what was going to happen. And like, but hold on, didn't we say we were going to? Where are the list of NGOs? What's going to happen? Can't we? And you could tell, they were coming to give us a brief.
And as early as 2016, at the early stages of 2016, when there was a rubber stamp of this plan to transfer these mental health patients, again the objections mounted, and they continued to mount against the Gauteng Health Department. And the sense that we've gotten from a number of people that we've spoken to, and this is quite public detail, that these pleas and these concerns that were raised in early 2016 about the transfer of the patients were in fact ignored, and the department forged ahead with it. And the plan was to, in 2016, in March of 2016, start the transfer project. But that was then delayed because of a number of concerns again, and a number of litigations against the department brought forward by Section 27 among other organizations and lobby groups. That then stalled, and they were given about a 3-month extension to then thrash out somewhat the plan before it could go ahead. But in March, we then see that first transfer happen. It wasn't at that point at a large scale, but we then see that happening. And the very first of those deaths, at least the known deaths, were actually reported in March of 2016. And so the transfer project then continues, and it gains momentum despite the mounting objections from these organizations.
In March 2016, when at one of these meetings, somebody mentioned that in a few days' time, 54 people will be moved from Life Esidimeni to a place called Takalani Home. And that was a place that in the documents that we've been provided in these meetings, it said was licensed to take care of mentally disabled or intellectually disabled children. But none of the people on the list was a child. And some of them had intellectual disabilities, but others also had mental illnesses, which is a different thing. And others had physical disabilities. And so it was clear then that the department was just going to move people regardless of what they needed and regardless of the capacity of the places they were moving them to. And so we litigated again to try and stop that. And we were unsuccessful in that case. We were unsuccessful because the department misled the court, and also because it's very difficult for a court when a government official comes and says, we know that it said this was a place for children, but actually that's not correct. We have licensed it as a place for adults, and it's completely capacitated. And the court said, well, I'll take the government's word for it. And unfortunately that then opened the floodgates, because at that point the department stopped consulting at all, even though the consultation before had been anything but meaningful. And it started moving people. And between March and the end of June, around 1,400 people were moved from Life Esidimeni into NGOs, and NGOs that were completely unprepared, unqualified, inexperienced, and not able to care for mental health care users.
So August 2016 becomes a very critical part of the timeline when it comes to the Life Esidimeni tragedy. And in 2016 of August is really where a lot of it comes to light. We hear in the legislature, the Gauteng legislature, where a lot of the MECs are held to account by the various committees that they report to, is where this came to light. Qedani Mahlangu was called to account to the health committee, where she needed to, again, as had been a part of what they called consultations, though some organizations said was a lack of consultations. She then had to go back to the health committee to debrief really about what had happened so far. And during this infamous committee meeting, she was asked by Jack Bloom about how many deaths exactly had been reported in this now failed or this now botched Life Esidimeni marathon project.
Then the first stories came in that they were being mistreated, and then I heard from various organizations that there may have been deaths. So in September 2016, I asked a question for oral reply. I wanted it to be for oral reply because it's more direct, and you can't waffle with, you can do a follow-up question, and I made it very simple, how many deaths have occurred, or have the deaths occurred? If so, how many? And I recall at the time in September 2016, she sort of waffled around it, and then she said 36 deaths have occurred. Now, I mean, I was actually shocked, and it was the first real evidence we had that people were dying, because it was in the legislature. She was forced to reply to it, and we got the figure of 36 deaths.
So now we're at the point where the Life Esidimeni matter is not only a domestic issue, but it's quite frankly become quite a dark stain in South Africa's history, internationally as well. And we've grabbed the attention of international players who are watching with a hawk's eye, really, about what was outplaying, here on South African shores. The matters then escalated to then Health Minister Aaron Motsoaledi. Funny enough, he's circled back to being the health minister again now, as this begins to unfold again and it reaches somewhat of a pinnacle in the issue. It's escalated to Aaron Motsoaledi to have a look at, and he then initiates a process where we have our first health ombudsman, who, in the form of Professor Malakaporo Makgoba, investigates the matter and issues a damning report about the callous disregard of human rights that had unfolded during this now botched Life Esidimeni project. And it's a 56-odd page report where he details some of the deficiencies that had played out, the timeline of what had happened, the concerns and the alarm bells that had been rung throughout that process, missed by the Department of Health, the MEC, the Provincial Department of Health, as well as the Gauteng MEC for Health, Qedani Mahlangu.
I just got an SMS on the 30th of June. Was it 30th, 31st? The last day of June? Your sister's been moved today to Cullinan Rehabilitation Center. That was it. Called Cullinan till we couldn't call anymore. We kept on calling because I've never been to Cullinan, so I don't even know where it is. And nobody answered. We kept on phoning Manamela, the other officials whose numbers we had. I couldn't reach Cullinan for a good couple of days. And eventually when I did, they told me my sister wasn't there.
We wrote a letter on behalf of SADAG and the families in June to say, this is what's been happening. We have received all of these reports, and there is a huge risk of what SASOP had warned earlier, of people leaving these homes because they weren't secure, of them becoming homeless, ending up in jail, which is what often happens in cases of deinstitutionalization because people end up on the street, and of severe health and life-threatening consequences. And we said that in a letter in June. At that point, a lot of moves had happened, but plans could have been made to move people back to safety. And this whole time, it was clear what was going wrong. The department was warned about it. The MEC was warned about it. The HOD was warned about it. The Director of Mental Health was warned about it. And all of that fell on deaf ears. And then by the end of June, everybody was moved. And people, even during the process, had started dying.
We then had the arbitration process, which is spearheaded by Dikgang Moseneke, who then has a bulk of the families testifying about what they had been told in the early stages of the plan and what had actually unfolded and how they had been treated in the process, how their loved ones had been treated in the process. Some of the harrowing details about how this project was being undertaken by the Department of Health includes patients being moved on trucks as if they were herd of sheep or herd of cows from the Life Esidimeni facility to the NGOs where they were destined to go. Again, there was no clarity about who was being allocated to which NGO, how this allocation was being undertaken, whether the families had been notified, and whether these NGOs were equipped to absorb these patients that were now being taken. Again, public record shows us that in fact a lot of the NGOs NGOs that the transfers were being allocated to were in fact not registered, didn't have the nurses that had the capacity and the skills to deal with these mental health patients. The records, the medical records of these patients were in fact also not transferred with them. So you had a number of mental health patients who were transferred from Life Esidimeni to these NGOs, but nobody at the NGOs had any idea of how they needed to be taken care of, what their condition was, what mental health condition they were suffering from, because of course there's a very broad range within the mental health spectrum. And so when you have NGOs that are in fact dealing with patients that they aren't too certain of what medication they need, how often, what other care is required, the problem then begins.
She's passed. She didn't even bother to call to say she's not well, she's whatever. She called me to say she passed. And she passed on the 17th, she said. Mind you, that's the 25th, right? And then I find out, no, actually, she passed on the 11th of August. So you see that there was nothing that actually showed that these people were trying to do the right thing. For me, it felt like every step they took to them was to, I don't know, to try and cover up. You know, when you try and cover up something wrong, you obviously, if you're telling a lie, you're going to keep on having to add and add and add to the lie. That's what I felt like. But I found this out afterwards. Had it not been for the arbitration or the inquest, I would not have known any of these things. And unfortunately, it's typical of government. Something horrendous needs to happen for it to stop. You can't stop it in mid anything unless something horrendous happens. That's the problem with government. Even when you see there's a problem, even when you are warned, but if they don't want to stop it, it will not stop.
Full circle, we now have the Pretoria High Court expected to hand down the judgment in that matter to determine whether or not anybody should be held criminally liable for the lives that were lost, 144 perhaps plus lives that were lost during that Life Esidimeni tragedy, which will forever remain a stain in South Africa and perhaps even known as the biggest mass deaths and the biggest disaster in the public healthcare sector. Nokukhanya Mtambo, Eyewitness News.